So the government has actually followed the recommendations of the WHO in addressing the COVID-19 pandemic by focusing on aspects like test, trace, and treat. So with respect to testing, of course, we know that nobody actually had enough resources to make sure that there would be enough RT-PCRs available for the number of people who needed the testing. And so one of the things that had to happen was ensure that laboratory facilities would be available, the reagents would be there, and make sure that we had distribution networks available so that different parts of the country could access testing. With respect to treat, of course, there was a focus on making sure that the staff were trained, we had enough people, the hospitals would have the facilities to be able to isolate individuals who were infected with COVID. And that was a challenge which I think was quite well met. I think there was a lot of focus on making sure that hospital-based care was going to be consistently available. So a lot of effort was placed on defining the capacity of the hospital system with respect to what would be allocated for COVID beds, the kind of staffing that was needed, making sure that there was enough supply of medications and other personal protective equipment. However, with respect to tracing, we know that we would have wanted more resources directed towards that, but there were efforts to get it online. Efforts continue, but I think we can do much better. We keep hearing about contact tracers ending their contracts. And I think that just goes to show that this was not really embedded into the infrastructure. The public reaction to some policies has been mixed. The mixed reactions generally come from people not being able to understand the context about certain policy directions. So I think a lot of effort really needs to be invested in communicating with the public, talking to them about why certain things are being done, and what the expected outcomes are. There have been some policies that have really been supported by the public. Like whenever there's a surge, people are really looking forward to an announcement that a community quarantine would be implemented. But for certain other policies, like right now, there's this discussion about no vax, no ride, or mandatory vaccination in the workplace. Those are obviously going into the realm of affecting personal liberties. So there are no easy answers to that. I think this needs to be a matter of continuing dialogue. I think if people feel like their reasons are being heard, that they're being given options, then probably we'll get a better reaction from the public. So whenever there's a discussion about getting a policy online, a lot of it typically has to do with how do you make sure that people are allowed more mobility without increasing the risk of transmission. So for example, with the no vaccine, no ride policy, the considerations included the need to allow more people to access public transport, but at the same time realizing that we had limited options available. But we have to also think about, are we actually allowing or are we actually able to provide everybody with the opportunity to be vaccinated already? Has access been equal? So maybe when we get to that point, we can say that the only reason why you're not vaccinated is because it's your choice. Then a policy like that might make more sense. So on the question of whether the IATF has been effective in actioning COVID-19 mandates, I think it's useful to have a structure like that because you have the key people, the key decision makers available within a group so that the communications don't have to go across so many different levels, and you can actually get a plan online in the shortest possible time. I really got to appreciate the fact that you had all of these decision makers available at a single time, conducting a discussion on various aspects of key issues. But I guess we're all still learning about this pandemic until now. And I think the real issue is that we can only work on or make a decision based on what's available in terms of the knowledge at that time. We know that the IATF actually is in charge of crafting policy, and the implementation is care of a lot of the different agencies and the local government units. So I think it would have helped if there was more input from the LGUs. Of course, they're represented in the IATF, but there's so many different LGUs with different capacities and different realities on the ground. And I think that's really a problem. So maybe in those instances where people think that the response was not adequate or could have been improved, I think maybe one way to think about is if you consider the context, was that the best possible decision at that time? And I'd like to believe that usually the answer is yes. So with respect to the core strategy of the IATF, I think if you look at how they've been making their decisions, the goal has really been to make sure that we have the least number of deaths. And this is the same goal that many different countries have. And at the same time, balancing this need with respect to healthcare outcomes with the need also to make sure that we have a working economy. So that's a difficult balance to achieve, actually. Any new administration that comes in will need to be able to get the public to buy into their policies by making sure that communication is a focus. So I think the new administration can focus on two critical things. First is investing in a telecommunications infrastructure that supports healthcare needs. We want to be able to count on information technology to capture data, to record data, to share data. I mean, if you think about the way our vaccine records are constructed now, something very simple doesn't need second thought, but it's a struggle for us to get that information into the hands of every individual. I think it's also going to be very important for the incoming administration to think about how they can better support healthcare professionals. So make sure that the people who are already here get what's due to them, and also make it more attractive for people who are thinking about a career to consider healthcare professions and staying to help the country. One of the solutions is really to make sure that universal healthcare is implemented. With that, a patient can expect that at any point in the system, there's going to be a way for them to get their needs addressed. And so if we can fast-track implementation of this system, make sure people can access it, then we can expect that there will be a more efficient solution to the continuing demands of COVID and all these other healthcare problems. So in comparison to different countries in the region, in Asia, and even globally, I think one of our big pluses has been keeping our mortality rate low. I think this is really a tribute to how well our healthcare professionals have been able to manage the cases that come their way in the hospitals. But I wish we had the resources that other countries had with respect to tracing, because this would really have been able to limit the cases that we've had to deal with and allowed us to focus what resources we had on the more severe cases. I think our healthcare system will do its best to handle another large-scale outbreak, really based on the response of our healthcare professionals. I don't think we can count on many more beds being available or more resources being available. And much as I wish that we had more people, that's going to take time to train. But I think the public can always count on best effort from healthcare professionals to carry us through any crisis. So from what I've observed, our government's plan to exit the pandemic is pretty similar to what other governments are thinking about doing, shifting from a pandemic emergency response to a mindset that thinks about COVID as something that will stay and learning to live with it to the best extent possible. So just thinking about how you deal with other diseases that continue to be a problem like dengue or measles. Life doesn't stop because those diseases are around. We just need to be able to figure out how to manage them while allowing people the mobility that they need to be able to function in society. So, unfortunately, COVID is a lot more contagious, so we need the help of all of these public health measures that we can put online so that we can contain it at the same time allowing people to move around. So the new government can think about how to make what we do now more efficient in the effort to be able to live with COVID. If you think about public transport, for example, there can be a lot of interventions about making sure that it's less crowded and we make it less likely that people who take public transport are going to catch COVID as they go about their daily routines. We can talk about making sure that regulations are in place so that air quality is much, much better and people don't have to give it a second thought that they might get COVID just by being out in public. So when we think about when the Philippines is likely to return to normal, I feel like there are two important issues that need to align. First is we need to get more people to be vaccinated. And then second, we need to get the virus to cooperate and not mutate any further so that the protection that we can expect from vaccines continues to be in place.